There is a lot of confusion about black cohosh, particularly in terms of the treatment of estrogen responsive cancers of the breast. It appears, looking at the scientific knowledge, that black cohosh, although it has estrogen like effects, these are not exerted through estrogen receptors. They don't upregulate estrogen dependent genes, and it appears that they do not stimulate the growth of estrogen dependent tumours in experimental animals. So there is very little to support any concern in breast cancer. However, I generally don't advise people to use black cohosh over the counter, mainly because it is a herb that their hospital doctors are uncomfortable with prescribing. And without professional advice and support, it is very difficult for patients to have confidence in their own judgment when they themselves haven't got the training or the information. So generally, it is a situation where I would recommend that people see a medical herbal practitioner for advice, especially if they're incorporating any herbs into collaborative care with chemotherapy or radiotherapy, and that would go across the board. Herbs do have a lot to offer in these situations, but it wouldn't be something that I would advise in an over-the-counter context. This is a picture of black cohosh. It's being grown in England. It's grown at the edge of woodlands. Very nice spike of a flower, lovely luscious green leaves, and a very lovely plant. This is the women's tea. So again, we're looking at what actions might be useful for PMS. And these teas are really very good for around the time of the menopause. And you're looking for hormone balancing, astringency, decongestant, and diuretic. And the herbs in the tea are lady's mantle, which has an astringent effect. It helps with flooding or heavy periods. It has an alterative effect for blood cleansing and a hormone balancing effect. Raspberry leaf has an astringent effect both on the gut and on all the pelvic organs. And shepherd's purse is blood stopping, which is slightly different from styptic, which is a tightening of the blood vessels, and an astringent action. It's a diuretic, hormone balancing, and enhances circulation. So good for any bleeding disorder and also for pelvic congestion, which can cause painful periods. Dandelion leaf is a diuretic and a nutritive herb, again useful for that cyclical bloating and blood cleansing, and also very nourishing, particularly for potassium. Yarrow, as we know, has all of the diaphoretic, bitter effect, also a very decongesting effect, particularly on the pelvic organs. It's also very good for venous return and venous congestion from the lower limbs and through all of the pelvic veins, and for the small vessels. It's also wound healing, so if there's any cervicitis or inflammation, it has a healing effect for any exposed blood surface areas. And that's how you would describe the cyclical bleeding. It's an exposed blood releasing bed in the lining of the uterus. This is a picture of shepherd's purse. It tends to grow between cracks in walls, along pavement edges, along hedgerows, especially where there has been disturbed earth. And you can see the little purses, which are the seed capsules, and they're shaped like little sporons. It's a very insignificant little plant, and you may well have passed it by. Again, a successful weed. Grows all over Europe. I've spoken to French people, Bosnians, and they all say the same thing wherever you go, that this is a women's herb for regulating the menstrual cycle.